What is the difference between a hair transplant and platelet-rich plasma treatment for hair loss, and how do I know which one is the right one for you? Today I'm going to be talking to you guys a little bit about both treatments and why one might be better than the other for you, but it's also best to get a personal evaluation by a board-certified dermatologist because there are so many causes of hair loss, and we can't really clump everyone into the same category. Platelet-rich plasma is a relatively new treatment that has been used in other fields of medicine for many years, but now recently has gone into the hair loss space. Essentially what it is drawing your own blood, like when you go to the lab, and then we centrifuge it down and we will inject a small, very concentrated portion of that blood, which has platelets with many growth factors, into your scalp to stimulate new hair growth and to thicken the hairs that you currently have. It's an excellent treatment for patients who have female or male pattern hair loss, which is the type of hair loss that we see most commonly, where men tend to bald up here and have a receding hairline, and women tend to have widening of their part lines, so more and more of their scalp is able to be seen as they age. It's also used for a few other hair loss conditions like telogen effluvium, which is stress-related hair loss, or even alopecia areata. Platelet-rich plasma typically is done once a month for 3 to 4 months, and then once a year annually for maintenance. How is that different from hair transplant? Hair transplant is a minimally invasive surgical procedure where we actually take hairs from the back of your head and transplant them into areas where you are balding, okay? And this is actually a procedure that is a permanent hair regrowth method. The hairs that we transplant will be permanent and they don't shed like the rest of your hair. It's best for patients who actually have significant bald spots where there's almost no hair at all, and it's very difficult to get hair back with PRP or oral medications or topical medications in those cases when the hair loss is more advanced. So hair transplant would be a good option for those patients. Also, it can be used for scarring types of hair loss like CCCA, lichen planopilaris, or even discoid lupus, as long as those have been medically managed first and are burnt out. If you have any questions, I would be happy to see you as a patient at our office in Southwest Houston. Please give me a call and we can set up a consultation. Thanks, have a good day.